welcome back to my channel. This is going to be a week in the life of a nursing student, be as a nursing student. Excuse me because I'm kind of under the weather a little bit. I'm recovering from a sinus infection, so just bear with me. So if I sound kind of like stuffy, that's why. Yeah, but this is gonna be the start of my week in life. We're gonna be prepared for Pharm 2 exam 1. So yeah, just follow along with me while we get that. So the next time you'll see me, I will be studying for Pharm and probably going through some NCLEX style questions. So just bear with me with that. What's on the agenda for this week? To study for the Pharm 2 and be ready for checkoffs for this week. We're checking off on Ngtubes, placing the Ngtube in. So I will take you guys to lab because I'm definitely going to go to lab to practice that. But yeah, I'm going to study hard for Pharm. I made a 75 on the quiz, so I'm hoping to do really well on the actual test itself. So just follow along with me as I do that. So stay tuned for the video. Hey guys, so I am back. So on the agenda today is going to be completing the remaining ATIs, shadow health, and completing the drug cards. So yeah, so I'm kind of feeling a little like stuffy. I feel a whole lot better than what I was. Had like a sinus infection, so recovering from that. So I will take you guys along as I complete. I won't take you guys along with the ATIs because those I have to be on there for an hour itself. But I'll take you guys through the shadow hills because I think the shadow hills are a little bit more entertaining. So I'll take you guys along once I start my shadow health and then get everything submitted from there, and then we'll come back and talk then. So we'll head over to shadow health and get started with that. Okay, so we are here on shadow health, and right now I'm just like, I guess I'm trying to click through and try to see where I'm going. But the point of shadow health is kind of like I said, to me it's like a virtual clinical to me. That's the best way I can explain it. It is very, 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 very time consuming. It typically normally takes me between like 30 to 30 minutes to an hour to get shadow health done. I'm not sure how everybody's, nursing program is, but mine's, they just incorporated shadow health, and it's just very, very time consuming. It's helpful, but it takes a while to get it done, because you got to go through the step by step. Like now, you got to wash your hands, introduce yourself. You have to do things normally like how you would do out in the clinical setting, and it's very tedious because it's very specific on the way that it wants things. So right now I'm over here just reading the shift report on what's going on with the patient, the SBAR, which is the situation, background, assessment, and recommendations for the patient. Right now I just got finished washing my hands, and then here we're going to be doing a 2-patient identifier, I believe. Yeah. Looking at the patient's armband. You do want to look at the patient's armband to see if they're a fall risk or if they're allergic to something.
Like, for example, if they were allergic to penicillin or something, it would be in red. They'll have it on their wrist with their armband that says um, penicillin on it, meaning, hey, they're allergic to penicillin. So, you know not to give the patient a medication that involves penicillin. So, right now, I'm just doing the assessment piece of everything, and right now I'm getting the blood pressure because when you're seeing your patients, the first thing you do want to get is a set of vitals on your patients because vitals are important. Hence why it's called vital signs, because it's vital. If a patient is in pain or something like that, typically they'll have a high blood pressure, or you know, um, heart rate will be elevated. Um, but here, this is a normal tensive blood pressure. So that's why I'll go over here and click normative, and then for there, I'll be getting a heart rate, which is heart rate is normal as well because it's 60 to 100 beats per minute. But yeah, this is what just shadow health consists of. Like, it's basically like a virtual simulation of what clinicals is. You got the patient, you're doing your vital signs on them, and yeah, you find out if they're what's going on with the patient. You got a whole situation with the patient. You get to look at the MAR, which is where you see their medications, the type of labs, the type of orders, documentation, flow sheet, objective data, all of these things that you have been learning, from your previous classes, is all wrapped up into shadow health, and you just basically just implementing it. So just be prepared to be doing a lot of ATIs and shadow health in nursing school, um, because yeah, a lot of this stuff is a lot of things are starting to become digital now. So, and then when it comes to technology, it's good when it's good, and when it's bad, it's bad. Because I don't know, like sometimes when I'm typing in questions for shadow health or answers, it's not the response that they're looking for because they're looking for a certain response. So I'm just sitting here 15 minutes reiterating what I tried to say the first time, and it's just like, Jesus, like, golly, can you just take my answer and move forward? But no, they're very specific when it comes to shadow health. But this is just a rundown of the vital signs. Right here, I'm just asking the patient what's their current pain level, because that is a part of the vital sign. You have to ask, what is their current pain level on a scale of 1 to 10? And right now, she's telling me that she's a 7, so she's in pain. And you see why it says they're in green, like it checked off, because that was one of the questions I should ask the patient. And then after that, it's asking me to be empathetic to the patient, responding that she's in a 7 out of 10. So I gotta basically say, I'm sorry that you're in pain. Y'all don't say it like that, but I'm just, I wouldn't say it like that to the patient, but I'm just saying, for the purpose of shadow health, I have to be like, I'm sorry that you're in pain. I'll do my best to, help you. But, in the real world, you're not the reason for their pain, but you do want to let them know that you hear them and you understand that they're in pain and you are here to help. So make sure you say it like that and you'll be good to go. I'ma just lay back and crack this window. I've been doing my best, taking a moment to rest, feeling stressed out. Give it a cut. I put that on God when it gets hard. I stay on my job like no days off, so you can go home. Okay. So we are back, and it's a different day because it was really, really late.
when I had stopped at the halfway mark of when I was doing my drug cards. I did like about 6, and I said, no, I'm gonna do the other 6 today. So I was able to finish my drug cards. So I was able to finish my drug cards. I did already turn them in. I was able to knock out ATI. I don't think I did any shadow health besides the one that I did yesterday. But I think I got 2 more to do, and that's it. But I'm going to save them for a different day because they ain't due until a while from now. So on the agenda today is going to be, number 1, I need to update my board, my dry erase board calendar, so I can be organized. You know, I'm trying to be organized this quarter, so I can be organized, so I can know what I got going on. So with that, I'm gonna erase all the stuff that I have on here for January, because y'all, January went by so fast. I don't know if it's just me. It's like I blinked and now it's the end of January. So like January just really, really flew by. So it's time to do February, which February is a short month. So already. So I'm gonna go ahead and do my calendar for February so I can be all set and organized for that. I had already filled out my planner completely. Because, y'all, I've been really meaning to fill out my planner completely. And I just haven't because the dates been changing. So I didn't want to put in the dates until I knew what everything was for sure. So now that I know everything is for what my dates are, me and my classmate did go ahead and, fill out our planners together on FaceTime, and now I got everything rocking and rolling. So I know what I need to be doing, how I need to put it up, how I want to set it up. So I'm going to show you guys how I do my calendar, and so yeah, be ready for that. So stay tuned. So we're going to do my calendar. So come on. All right. So first thing first, I'm just playing. First thing I need to do is erase this board. Erase. I need to take this down real quick, because that ain't mine. Okay. First, I need to do February 1st falls on a Wednesday. So this is the 30th, 31st, 1st, 2nd, 3rd, 4th, 5th days in February. Okay, ends off on a Tuesday. All right, so I gotta pull out my planner to get this done. But while I'm doing this, getting all of my stuff written out properly, y'all, this little thing, it says "Hollow Queen, congrats." So, quick story time. So, y'all, for Halloween, I dressed up, me and my best friend, we dressed up as Harry Potter, but I dressed up as Harry Potter if he was in Slytherin. And then it was a really nice costume, and we went on this riverboat ride. So it's kind of like ooh, hold on. That's week 4. So we went on this riverboat ride, right? So she dressed up as a Gryffindor. I dressed up as Harry Potter, as if he went to Slytherin. You know, originally I'm a Ravenclaw. We went to this riverboat. It was like this boat ride. That's like a 2-hour ride, and it was a Halloween theme. So everybody had their costumes and everything. And then I got like free drinks that whole night. And I got free drinks that whole night and everything, y'all. So tell me why they had like a costume party, well, a costume contest. So in order to win the costume contest, you had to dance. Y'all, one thing about me, one thing's for certain, two things for sure, I'm gonna dance. And when they played that music, your girl showed out. I showed out. The drinks was already drinking because I was drinking. So I was like really feeling the drinks, and then they were like, "Okay, what's your name?" I'm like, "My name Harry Potter." So they played some random song, y'all. It was some blues song. I ain't never heard this particular song before, but they played the song, and all I know is I was dancing on a pole and I hit a split. I kid y'all not. That's all I remember. And then when I seen the video, I was like, stop. That was not me. That was not T cutting up like that. It definitely was me cutting up like that. But needless to say, I had a great time. And I did win like a free dinner for 2 crews. And so yeah. Take your opportunity to live life. I was really celebrating because I really passed this exam in Pharm 1 that was just extremely hard for me, but I was able to pass it with flying colors. So I was happy about that, and I had kind of celebrated myself that weekend and had me a couple of drinks that I was drinking. And yeah, I inserted the class.
Good job. That's your open up to get around. Talk to you. Come on with it, baby.
And due to copyright, we gonna bow, 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 a, and split. But yeah, and yes, it was so much fun, and I had a good time. Back to the video.
Back to this calendar, y'all. So we are rolling up on week 4. And I have an exam. I have an exam coming up. Week 5 is a break. Week 6. That's it for. Let me put fundamentals first. That's the class I got first. So I'm just gonna speed through and write this down, and I'll come back to y'all once I'm finished.
Doing my best, taking a moment to rest, feeling stressed out. Give it a good. I put that on God when it gets hard. I stay on my job like no days off, so you can go home with that. Jump on jealousy, my bad. Get away from me, 'cause I've been working all day. Can I catch
So this is me finishing the calendar. Oh wow. Yeah. Hold on, y'all. I think it would be fundamental if I write the month, wouldn't it? Hold on. Now that I got the month on there now, that's just what my board looks like. I just incorporate, like something like my goals, like continue to pray, stay focused, pass quizzes and exams, reward myself, stay organized, and keep a healthy relationship with my love, which is my husband. I think that's important for everybody that's in nursing school to always, keep and maintain healthy relationships, because you're going to need your support system throughout nursing school. And the biggest one of them all, remember, you will become Nurse Tatiana, because this is what I'm going to nursing school for, to become a nurse. So it's important that I remember I'm going to be Nurse Tatiana. So, yeah. Hey, y'all. So, right now, it's 12:46 in the morning, and I'm about to start studying for Pharm. Just gonna be studying for Pharm, and so the next time I'm gonna do a little bit of studying for that, and the next time I see you guys, I'm going to be preparing to take the Pharm exam, and then I'll take you guys with me for my morning for that. So I'll see you guys when it's test day. Hey guys, so it is test day, and I am on my way to class. My test is until this afternoon, so I'll take you guys along with me. I'll come back and check with you guys on my break, and let you know how I'm feeling about the test, and then I'll see you guys. Okay, I forgot to mention how I'm feeling about the test. I feel okay. I feel prepared for it. It's just one of those things when you just run into those NCLEX style questions, what you think you know versus I don't know. It becomes something totally different sometimes. So, but I am in good spirits and everything. So yeah, I'll see you guys on my break, and then we'll talk more then. Bye. Okay, so the test was horrible. It was like some stuff that y'all, I don't know. Nursing school, I don't know. That test was more so of a, I don't want to talk about it, y'all. It wasn't good. I haven't got my results back yet, so hopefully I passed. I should have passed, but we shall see. But I'm pretty sure I did pass. But it's just one of those things that I'm studying, right, but I just need to add a little bit more, and then I'll be good to go. So I'll be all set for the next quizzes and exams for sure, because I'm just now getting into what my study habits are, so I just need to hit a couple of things more. I just need to practice a little bit more with my dosage calculations, and I'll be all set, so, which I'm already on top of, so no need to worry there. So I'm just gonna continue to push myself, continue to study as much as I can. So yeah, so we're going to get into the clip of me practicing for checkouts for lab. So I hope you guys enjoy that. So let's get into that.
So the Ngtube for bowel obstruction alleviates the pressure, so the intestines. So
to drain the fluid for the blockage.
so it's able to pass the obstruction. Okay.
Okay, that's actually all right. So now that we know the purpose of why he's getting the NG tube, we're going to start off with the first steps, and that's going to be assessing his cough and gag reflex. So, Mr. Benny, can you? I'm going to have a fake tissue. He's going to get it. Okay, well, yeah, get it. What paper towel? We're going to assess Mr. Benny's cough and gag reflex. So, Mr. Benny, can you cough into this cloth for me? All right, great. So now we're going to assess his gag reflex. So I'm going to test your gag reflex, Mr. Benny. So I'm going to stick this in. All right, so his gag reflex is intact. All right, so now we're going to sit the patient up in high phallus position, unless otherwise you can't. But all right, let's bring this back a little bit. All right. So before we get the process started of inserting Ngtube, we're going to test for nasal patency, which is basically seeing which nasal area is
Which nair is more patent for you to insert the tube?
So I'm going to ask you, Mr. Benny, can you close each nostril and breathe? I'm going to say in or out?
In.
Breathe in for me. All right. Okay. So he said that the right one felt more clear. So we're going to go with the right one.
Okay.
So, Mr. Benny, we're going to be inserting the NG tube down your nose. So it's going to be a little bit uncomfortable for you as I'm sticking it up your nose. So if at any point in time it becomes unbearable or too difficult for you, can you hold up your index finger so you can stop? Because I don't want to keep going and you're coughing or you get uncomfortable and it coils up and then we have to start all over again. Can you do that for me? Yeah. All right, sounds good. So now I'm going to measure the NG tube from the tip of the nose, behind the ear to the zygoid process, which is about here, right?
The sternum area.
All right. So it's about 60. About 58. I can take. All right. So in order to activate the NG tube, we need to first inject 10 milliliters of water. Teacher, this is for practice purposes. So,
Your gloves.
I'm going to take my lubricant here. I do want to do this for real. Just a little bit. And then I'm going to put on my gloves. So, following whatever your guidelines is for your NG tube, you want to coat it in the lubricant. I know somebody back there listening to me.
You're doing a wonderful job.
Alright. And don't forget, Mr. Benny, to also to help for Mr. Benny to be able to tolerate it. He's going to be drinking water and swallowing it as I am inserting the NG2. So my assistant will be helping me. So, alright, Mr. Benny. Once I get towards the back, we're going to take a sip of that water and we're going to swallow. Are you doing okay? Okay, we just gonna take a break. All right. Oh, this is a lot harder than it. Jesus. Okay, good somewhere. Clothes ain't coming out the mouth. Alright, we'll take another break. We're almost there. You're doing great. Mouth wide open. Alright. Nose all sticky. Probably shouldn't wipe that up, but I'll guess it up for you next. Alright. Jeez. Okay, so we are, well, I am attaching a anchor piece to his nose. This is just to help so I can be able to check the gastric, aspirate the gastric contents to make sure I'm in the right spot. Just that checks to, make sure it's in the right spot. That's really like my, it's my first, well, like my second or third time trying that. And yeah, Angel did remind me I missed a step. With that, you gotta listen to make sure that listen to the stomach. Angel would have pressed air inside of it, and I would hear like the air sound inside of the stomach to make sure that I was in the right spot. But yeah, after I do that, then I take my piece of tape that I had split in half and I wrap it around to secure the NG tube, and then I would attach another piece of tape to go across the actual top of his nose to secure it, and then I would tape it to his actual gown itself, and yep, that is the end of it.
Okay, hey guys, so I was able to go ahead and get my exam grade. I'll put a picture of it in the clip. I did, end up getting a 70. That I passed. I literally passed because you have to have a 70 to pass. That's not good enough. A lot of my points went, I lost a lot of my points from dosages and calculations. So that's what I've been practicing on. So we have a break this week from quizzes and exams. So I've been really hitting it hard with my dosages and calculations along with studying as well. So I'll take you guys through that in the next week in my life video. But yeah, when it comes to exams, just you gotta pray. You gotta pray. Pray. But also, you have to do the work too. So like I said, now that I know where my weakness is, that weakness will be my strength. So just watch me as I progress and those grades go up instead of down. So yeah. Hey guys, so thank you so much for watching my Weekend of Life video. I hope you guys liked the video. Don't forget to like and subscribe to the channel so you can be able to see more videos from me. And don't forget to comment down below. I want you guys to spam the comments with let's see, the purple heart emoji, so you can increase your chances of being able to win the giveaway that I have in my the stethoscope that you guys see in my supply haul. Don't forget to watch that video, along with other items you can use for nursing school. So once I get to 100 subscribers, I'll be announcing a winner. But don't forget to comment down below to increase your chances of winning. So again, thank you so much for watching my video, and stay tuned for the next one. Bye.